So the first transfer that we're going to be performing today is going to be on bed mobility, and we are going to be using a log rolling technique. A log rolling technique is a technique where the patient's feet are going to be on the bed. So their knees are bent, feet are flat on the bed. And this is a technique that you're going to use for peri-care, repositioning in the bed, and if you have a back patient, because you don't want them to be twisting at their back. So I always want to make sure that I'm cueing my patient and getting them to do as much as they can, and so I'm doing as little assist as possible, but I will cue her. So if your patient is max assist, this is what it's going to look like. Okay, can you bend both your knees for me to where your feet are flat on the bed? Okay, and can you cross your arms across your chest? The bed's in the lowest position, so I want to make sure that I'm watching my body mechanics. So I want my feet shoulder width apart, and I want to make sure that I'm bending at the knees and keeping my back straight and not bending at the back. I'm going to have my forearm across her knees, and her head is going to cradle at my elbow, and this hand is going to be on the back of her scapula or her shoulder blade. I always want to make sure that I'm never pulling on a patient's shoulder or their neck. Here. Okay, and I'm going to count to 3. I'm going to roll her on her side. 1, 2, 3. Okay, and she's not going to fall off the bed because my body is guarding hers. My hand's going to move around the knees, and I'm going to pull her up. 1, 2, 3. Just like that. So it's in 2 parts. The first part, you want your patient side lying, and then the next part, you want her from side lying to sitting on the edge of the bed.